Around the World with MS World, I'm Dr. Daniel Kantor, Chief Medical Correspondent. Many of you at home may or may not realize that the MS World is also the official online chat of the National Multiple Sclerosis Society. And that is why I'm so happy to be joined by Dr. Ros Kalb, who is Vice President of Health Information and Resources at the National Multiple Sclerosis Society. Thank you so much for joining us yet again.
Thanks, Dan.
When people hear about not-for-profits for MS, they're hearing about a lot of smaller not-for-profits. What really sets the National Multiple Sclerosis Society apart?
Well, I think that the National MS Society has a great breadth of resources for people with MS, but we are also the largest private funder of MS research in the world. So it's a combination of funding state-of-the-art research in MS, as well as trying to make sure that people living with MS have the information and the resources that they need to live their best lives with this disease. So we try to do all those things for the MS community, plus finding ways to help people with MS connect with one another, because we know how important that is. And so we have a variety of connection resources as well for people to learn from each other.
I think that point is very important. You're saying the largest private funder of MS research in the world?
That's correct.
I think I heard a number yesterday at the MS Coalition dinner. I think it was like $50 million went into the MS research, what they funded last year, which is like an amazing number. Most of us can't wrap our heads around those kinds of numbers, and that's amazing, so thank you, and congratulations on that. Now, you're also very, very important in the document that I'm one of the reviewers for. Can you share with people back home what this document is, why it may be important to them as well?
Sure. So a few years ago, all of the member organizations of the MS Coalition, and there were 8 members at the time, there are now 9, came together to create a consensus document to talk about the importance of early and ongoing treatment for people living with MS. And it was a landmark document in the sense that it was one of the first projects where all of the MS organizations decided that it was important to come together to share their expertise and get a very clear message saying that early and ongoing treatment is the best way we have today to ensure the best quality of life for people living with the disease. So we did a document in 2014 bringing together all of the evidence. We had it reviewed by a number of eminent MS experts in the community, including you, Dr. Kantor, and then it was endorsed by the ACTRIMS organization and disseminated broadly, and we have committed to updating that document every 6 to 12 months, because the good news is in MS we have so many treatments emerging and in the pipeline that it's important that people have access to comprehensive information about those medications so that they and their doctors can have effective conversations and shared decision-making around effective treatment strategies.
And one of our points, I think, and now it's actually 13 separate branded products with one branded generic, and this is of 3 days ago, was that it's not somebody else who should be making that decision. It's really the person with MS, so the patient and the doctor or other healthcare provider together should be making that decision. How important is that?
Well, I think it's critical. It's critical because although all of these individuals are living with MS, for each person that experience is different, and their goals and priorities for treatment are different. And if we take the time to ask a person living with MS, what are your goals for your treatment? May be very different from one individual to another, and so it's only by having that conversation with the healthcare provider that together they can say, okay, these medications differ in a variety of ways. They offer some similar benefits and some different benefits. They come with different side effect profiles, different risks associated with them. And so only by talking together can they figure out which is the best option for that patient at that point in time to achieve the patient's goals.
Well, I think those messages of the doctor and patient, or the healthcare provider and patient talking together, and then the message of togetherness with the MS Coalition and how all the not-for-profits can really come together are so important. Dr. Ros Kalb, thank you so much for taking your time as always, and thank you for joining us at home.
Thank you.